Assalamu alaikum. My name is Mohammad Asim Hussain. My presentation topic is Zindagi Zinda Dili Se. I am covering 5 points in following presentation. Are all antidepressants same? Which one is first line antidepressant? Does doctor choose differently if the patient suffer from mild, moderate, and severe depression? Does anxiety level of anxiety influence doctor choice of antidepressant and some other factors while choosing antidepressant? As you know, depression is clinical heterogeneous disorder which include mood, physical and cognitive symptoms. When patients are reporting with emotionally symptoms, patients are complaining anxiety, hopelessness, sadness, irritability, lack of enjoyment, suicidal ideation, inappropriate guilt. When patients are reporting with physical symptoms, patients are complaining with headache, stomach pain, and different problems, weight change, insomnia, sexual dysfunction, psychomotor agitation, and pain with unexplained symptoms. When cognitive symptoms concern, patients are reporting with attention problem, complaining with the having problem with thinking, decision making, and planning. The most common acronym is using while treating depression or screening depression, that is low mood SIGI gap, is using by healthcare professional to screen depressed patient. Healthcare professional, if any person facing 5 symptoms from the last 2 weeks, he is suffering while mental health problem. Number one is low mood. It's very important. Number S for sleep disturbance. I for interest, G for guilt feeling, E for energy decrease, C for concentration, I for interest, G for guilt feeling, E for energy decrease, C for concentration problem, A for appetite, P for psychomotor retardation, and S for suicidal thoughts. Mostly patient in OPD reporting with both anxiety and depression. In cardiology OPD, most patients are reporting with anxiety symptoms. As this slide, some symptoms are overlap in anxiety and depression, just like fatigue, dysphoria, irritability, sleep disturbance, appetite disturb. When anxiety symptoms are concerned in cardiology, OPD patients are reporting with anticipating anxiety, nervousness, tension, muscular tension, restlessness, and different fibromyalgia symptoms. This slide shows prevalence of psychiatric disease in cardiovascular diseases in this segment. Studies shows prevalence of major depressive disorder is up to 10 to 30%, and some literature shows 3 to 40%, which is very high in this segment. The highest rate were found in the patient presenting with hypertension is 43.6%. The prevalence of panic disorder in both cardiology, outpatient and inpatient with documented coronary artery disease is to 10 to 50%. In social anxiety disorder, that is 28.9%, OCD 25%, and PTSD 20%. In this slide, we can see license indication of antidepressant. Sertraline is approved in all following indication, while escitalopram is approved in PTSD. And the other hand, you can see vatiquinone and agomelatine is only approved in major depressive disorder. Here I want to share very interesting study on sertraline, which was present in 2019. The journal is International Clinical Psychopharmacology. Objective of this is meta-analysis to see the efficacy and acceptability of 5 different antidepressants in ischemic heart disease. In this meta-analysis, 11 comparison, 5 different antidepressants, that is sertraline, escitalopram, fluoxetine, mirtazapine, citalopram, having 1685 patients. The result shows sertraline is a reasonable first-line choice in patients with IHD and depression. Following very interesting slide from Mosley prescribing guidelines of psychiatry. This guidelines or reference shows the cardiac safety of antidepressant. Green bar shows no effect on heart rate, blood pressure, QTC, arrhythmia, conduction disturbance, and post-MI. Yellow bar shows minimal effect of these parameters and red bar shows highlighted marginally increase in these parameters. Vatioxetine is safest antidepressant in cardiology, but vatioxetine and agomelatine approved only in major depressive disorder. While our next option is sertraline, which indicated in enhanced confidence of cardiologists, all psychiatric and approving all psychiatric indication, mostly anxiety patient reported in cardiology. Sertraline is more suitable choice in patient and depression mixed patient. To increase the confidence on sertraline, I am sharing study of American College of Cardiology journal. The objective of this study is to see the efficacy and safety of sertraline for depression in patient with heart failure. Result shows sertraline was safe in patient with significant heart failure. Patient reported 469 patient. Another reference from JAMA. Objective of this research to see the efficacy of sertraline in major depressive disorder in patient with acute MI or unstable angina. Studies conducted in 369 patients and results show sertraline is safe and effective treatment for the result for the recurrent depression in patient with recent MI or unstable angina and without other life-threatening medical condition. For support of claim safety and efficacy of sertraline, following research published in Clinical Practice and Epidemiological in mental health. Objective of this study is to see efficacy and safety of sertraline in depression with acute myocardial infarction in 6 months. Result shows sertraline is effective and safe in the patient. Antidepressant treatment might be associated with reduction of cardiac events. To enhance confidence of cardiologists, following study published in pacing and clinical electrophysiology, the objective of this study is to see the efficacy of sertraline in non-depressive patient with chronic ischemic heart failure. Very interesting results suggested that sertraline is associated with reduced ventricular extrasystoles, better quality of life, and a possible improvement in some HRV, that is a heart rate variability index. Following studies shows additional benefit of sertraline on antiplatelet and endothelium protective properties in cardiac patients. 10 to 30% of patients with symptoms of angina and sufficient to justify cardiac catheterization are found to have normal angiogram. The results of this study is sertraline is patient with non-cardiac chest pain produce clinical significant reduction of daily pain. That is the study of 2022. Latest study shows sertraline is preferred choice in the patient with cardiovascular disease and treating post-MI depression. Following slide shows possible side effect of all antidepressant, that is CANMET guidelines of 2016. No dose adjustment required with renal function in patients. Following are off-label indications of all SSRIs, including sertraline. This slide is showing pharmacokinetic of sertraline. The starting dose is 50 milligram OD up to 100 milligram OD. We are the most economical as compared to other brands. Thank you so much.